you talked about how Medicare, reimbursement and everything is hitting physicians and hospitals. There's only so much healthcare dollar. Who's getting all this? Like what's happening there?
Well, everybody likes to puke on hospitals. But when you look at the relative value, here is an organization that is open 24 hours a day, 7 days a week, and has to have the capabilities to treat anything that walks in their door. 40% of those hospitals right now are losing money, and many of them are unsustainable. At the same time, essentially the people that process claims, whether it's drug claims through their PBMs or insurance claims, they're making record profits. And one of the interesting things to note is how the profitability of the insurance companies, the for-profit insurance companies, have improved after the Affordable Care Act. I mean, the real winners, if you look at profitability, are the for-profits. They've gone from a $23 billion profit to a $76 billion profit. And their CEOs in 2022 of these insurance companies made a combined $136.5 million. So when I look at it, the people that are delivering care, saving lives are, I wouldn't say squeaking by, but they're definitely under financial distress. And the people that are processing their claims, they're making a fortune.
Yeah. I mean, we know that from speaking with clients. I mean, everything, they're all trying to grow volume and, in market share or access or however you want to put it, but then they always have to focus on their operating costs. They're constantly looking to tighten up. I guess when I look at this, I see this number here on a compounded annual growth rate is 10% growth. I mean, year over year, they're growing 10%. And you look at that. And so does this scream like, hey, hospitals, you need to be a Kaiser? Because you look at like a United, they're buying provider services, everything like that. What are your other takeaways other than the people who aren't providing the care are making the money?
So the first thing is no, you definitely don't want to get into an adjacent strategy. Our data shows that what we call payviders or provider-sponsored health plans, if they are making money, it's likely because of transfer pricing. That is, they're their lowest payer for their hospital. But most of them are not making money. And so we caution against that. The real answer is there's plenty of money. There's $76 billion of premium dollar that could be redistributed to hospitals and physicians and others to provide care. So we don't have to raise premiums in order to subsidize the underfunding by the federal and state governments. But again, if you look at these large insurance companies, they're very strong in lobbying, and it's awful difficult to get regulatory pressure on them. One last point, when people ask me, like, what's driving healthcare in our country, I call it greedonomics. I mean, you look at the drug companies, you look at the payers, you look at the device manufacturers, you negotiate with anesthesiologists, as I do. And what you find out that, I mean, economics is driving everything. Everybody wants to get what they feel they deserve, and there's just not enough money to do that.